Welcome to the 5th Annual Animal Health Hackathon at Cornell University. My name is Warnick, and I serve as Dean of the College of Veterinary Medicine. This event is co-hosted by our college, which includes the Center for Veterinary Business and Entrepreneurship, in partnership with Entrepreneurship at Cornell. The hackathon brings together students from across many majors and schools, both here at Cornell and elsewhere, and it provides an opportunity for each of you to put your creativity and teamwork to the test. Your innovative approaches into veterinary healthcare really give us a glimpse into the future. Before we dive into today's challenges, I thought it'd be helpful to just talk a little bit about the breadth of veterinary medicine. I think the profession is known to most people for providing veterinary medical care to family pets, but it's much more than that. For example, our graduates work in food production, in biomedical and pharmaceutical research, public health, wildlife conservation, and government agencies, as well as in human medical research through translational medicine and clinical trials. Opportunities in veterinary medicine are evolving rapidly, and the demand for services is higher than ever. As just one example, it's estimated that spending in the US pet industry is over $75 billion annually and growing steadily. And about half of that is represented by veterinary care, supplies, and over-the-counter medications. Globally, spending on veterinary services is also expanding rapidly. So what's driving this growth? On the companion animal side, pets are now seen as part of the family in the US and as well as in many parts of the world. People seek more sophisticated clinical services for their pets. They want high quality diets, and they want products for disease prevention. In other parts of the profession, the demand for food animal production is increasing as world population grows and affluence increases. And the expectations for safe, inexpensive food is higher every year. The increasing risk of zoonotic diseases, and zoonoses are infections that can be transmitted from animals to people. And this is really driving a need for veterinary expertise. They're also needed in research and development and other roles for private companies and health industries. And as an example, you may know that Dr. Albert Bourla leads Pfizer as the CEO. And Pfizer is, of course, one of the first companies to develop a COVID-19 vaccine, which is being used in the United States. And this is a really good example of what we call One Health. One Health is an interdisciplinary approach to improving the health of animals, people, and the environment on which we all depend. This is really important right now, especially as food insecurity is a problem in many places in the world. Almost 1 billion people have insufficient food, and many more consume diets that aren't optimal for good health. And at the same time, our planet's resources continue to be depleted. We're losing biodiversity, and climate change is reshaping our food production systems and may increase the risk of emerging infectious diseases as wildlife habitat and disease vectors are impacted. The connection between One Health and the veterinary profession was never more clear than over the past year as we've battled the global pandemic of COVID-19. The SARS-CoV-2 virus that causes COVID-19 almost certainly emerged from an animal reservoir, possibly bats, and may have been transmitted to people by contact with wild animal food sources. This is a pattern that repeats itself in infectious disease transmission and has been particularly observed in recent decades for coronaviruses. Humans and animals share the same physiology, the same environment, and in many cases, the same disease susceptibility. Veterinarians and researchers in our college and others at Cornell work at this intersection to understand and prevent transmission while also providing a safe food supply, protecting wildlife populations and ecosystems that we all depend on for health. This past year, veterinarians and scientists in our college played a critical role, first in detecting SARS-CoV-2 in animals, and then by partnering with Cayuga Health System to develop the COVID-19 testing laboratory, which since August has tested over 650,000 samples to help keep the Cornell community as well as the surrounding region safe from COVID-19. You know, COVID-19 has also had a far-reaching impact on veterinary medicine and clinical practice. According to an AVMA survey of over 2,000 practices, nearly every practice reported an initial decline in revenue, accompanied by a shortfall in cash and income soon after the outbreak started, and then a surge in demand in summer and fall. And as I talk to colleagues around the state and the country, many have never been busier than through last summer and fall of 2020. This has required a lot of adaptation from the profession, doing things to operate safely, like having curbside drop-off and pickup for pets brought to clinics. They've also, many have been using telemedicine much more extensively in the past, and this has been a great way to offer services more safely during the pandemic. And as we move beyond the current situation with COVID, we expect that many of the changes experienced during the outbreak will be play some role in how practice is conducted in the future. An additional challenge for animal health is to increase diversity in the veterinary profession and to better serve diverse populations, communities, their animals, and provide wider access to information and services. You'll learn from entrepreneurship researchers that diversity among team members really leads to better outcomes in teams that are working on innovation and new ideas. So as you think about the hackathon challenges, I encourage you to consider diversity and equity and think about how your ideas may help support access to care, support diversity in veterinary business ownership, and help cross language and cultural barriers in a way that grows opportunities in our profession. So as you work during the hackathon to apply your ingenuity to animal health problems, I just want to add my thoughts that the profession really needs innovation at this time in diagnosis, in working on compliance with treatment and other directions provided by veterinarians, in methods of communication, transportation and access to care. And we need new business models that meet the needs of people across the socioeconomic spectrum. We need inclusive education models, both during veterinary degree programs, but also after graduation. So there's a lot of areas where there's opportunities in the profession to innovate and develop new products and services. I hope these comments help to provide some broad background about the profession, as well as some of the current trends and how veterinary medicine needs to change to solve the current challenges in health for animals and people. The hackathon, as I said, brings together people from many different fields. Each of you offer a unique perspective, and I hope that you'll be able to step out of your own comfort zone and collaborate with people who have other backgrounds and interests and who bring a different expertise to the problems you address. every year I'm so impressed with the ideas that are generated at the hackathon. And though we're meeting virtually this year rather than in person, I expect it will be the same. And I really look forward to hearing all the great ideas that you come up with. I hope you have a fun and rewarding experience in this, the 5th annual Animal Health Hackathon. And thank you.